What seems to be happening in our practice is we announced a year ago that we were no longer taking care of patients, that we were taking care of participants. That the way to conquer chronic pain, notice we don't say cure chronic pain, is to develop a personal practice. The first step is to begin participation. You are not passive, you are an active participant in building a practice. And at some point in time, you will become your own practitioner.
The Asclepius Complete Care membership model incorporates both functional medicine along with biomedical and biopsychosocial approach to treating chronic pain. We find that this approach helps us better diagnose, treat, and understand chronic pain. We use this with helping our patients develop a personal pain management practice. The personal pain management practice is a practice that is developed with both the patient and the medical provider. We try to enhance and strengthen what we call the foundations of good health. And the foundations of good health consist of really strengthening and understanding what having a healthy gut and a healthy microbiome does in aiding in digestion, immune health, mental and physical health. We also take a look at healing nutrition with the identification of food sensitivities and allergies for individual patients, and also really focus on developing an anti-inflammatory diet, especially for patients with chronic illness and chronic inflammatory diseases. We also look at appropriate movement and exercise, help patients identify what they enjoy to participate in, and also what's the proper technique and the proper posturing in order to avoid re-injury. And this also helps patients decrease the fear of re-injury while participating in activities. We also talk about recognition and command of stress. We know that stress hormones are extremely influential in chronic inflammatory diseases, especially chronic pain. We offer restorative yoga and meditation sessions that focus on establishing relaxation response breathing and allow patients to practice mindfulness and start to have some presence of mind in order to start making some of these life changes. What the membership does is it allows patients scheduled access to the facility, to the staff, and to the providers. That's usually not covered by third-party payers. And what we're noticing is that when patients have access to these amenities and to these resources, it's much easier for us to start to develop a comprehensive and integrative approach to managing chronic pain.
The way we retrain our nervous system is through daily practice. This is neuroplasticity, that neurons that fire together, wire together. We create new pathways, and if you don't use pathways, they become dormant, so you can unlearn a learned behavior.
Asclepius Complete Care programs available to participants include the Headache and Migraine Program, Neuropathic Pain Program that includes treating Chronic Regional Pain Syndrome, or CRPS, Fibromyalgia and Chronic Fatigue Syndrome, patient-specific complex condition programs that include pelvic pain or non-specific or more complex conditions, abdominal pain, chronic pancreatitis or pudendal neuropathy, neck and back pain program. And all of these programs include a 6-month membership to the facility that includes scheduled access to the fitness facility, restorative yoga, meditation, nutrition courses, and medical services after the fact. The reason that we offer the 6-month membership in addition to the program is because once we've had this 12-week intensive course that is really focused specifically on the patient's disease and diagnosis, we want to be able to allow for sustainability of care. And that's when the membership starts to kick in, and the patient and the medical provider work together to develop a schedule and a program that is specific to them and that fits into their life.